So, welcome again to a new video. We are going to start lower limbs today, and first we will cover the basics and the front of thigh, the medial side of thigh, the back, then the popliteal fossa, and then we will conclude this video. Okay, the back of the thigh, back of the leg, front of the leg will be covered in the next video. Okay, so starting with the lower limbs, the basics of lower limb. The basics of lower limb are thigh, leg, and the foot. So, what is the thigh? Thigh is the part which extends from your hip joint till the knee joint. Leg is the part which extends from your knee joint to the leg is the part which extends from the knee joint towards the foot or towards the tarsal joint. Then the foot is from the tarsal joint to your phalanges. Okay, now starting with the thigh. So the thigh consists of 3 compartments in total. So what are the 3 compartments? The 3 compartments are the front compartment or the anterior compartment, and then the medial compartment, and then the posterior compartment or back of the thigh. I better write it as anterior. Okay, so the anterior compartment is also known as extensor compartment. Okay, extensor compartment, and it consists of the muscles. I will write the short form a bit. Okay, so the anterior compartment consists of sartorius. I will highlight this sartorius. I will tell you later why I highlighted this. Sartorius, the rectus femoris, then the vastus lateralis. I will write it as, this is the spelling, I will write it as VL, vastus medialis, and vastus intermedius. Okay, these are the 3 vasti muscles, and together I will just highlight a star here. Together they are known as quadriceps femoris. Together, these 4 muscles. Okay, the medial compartment is also known as the adductor compartment, and it is responsible for adduction. So adductor longus, adductor brevis, and adductor magnus, and one more muscle, the gracilis. Posterior compartment is the flexor compartment, so they are responsible for flexion at the knee joint. So, and the medial compartment is adduction of hip joint. Okay, abduction of the knee joint, adduction of the hip joint. Now the posterior compartment consists of long head of biceps femoris, short head of biceps femoris, semitendinosus, and semimembranosus. Okay, these are the 4 muscles in the posterior compartment. The leg. Now, before going to the leg, I have highlighted this sartorius. So why I have highlighted it? So let me note it somewhere. I will note it here. The highlighted portion is sartorius is the only flexor of hip as well as knee. Means this muscle causes flexion at both joints. This is the only muscle which causes flexion of hip as well as flexion of knee. Means at the same time, if flexion of knee is occurring, so flexion of hip will occur by sartorius. Okay. Now the leg. The leg, it consists of 3 compartments. Okay, the anterior compartment, the posterior compartment, and the lateral compartment. The anterior compartment consists of muscles. I will write the short form, tibialis anterior. Okay, then extensor hallucis longus. Anterior compartment is also the extensor compartment of the leg. Okay, extensor hallucis longus. Then the extensor digitorum longus is also present in the anterior compartment. Okay, So these are the three muscles in the anterior compartment. Now, also, oh, I forgot, peroneus tertius is also present in anterior compartment. Then the posterior compartment. The posterior compartment consists of the lateral head of gastrocnemius, the medial head of gastrocnemius. A small muscle present on the lateral head of gastrocnemius is the plantaris. Also, more deeper to these muscles consist of our soleus, the peripheral heart. I will mark it and I will note it. It is, oh sorry, it is the peripheral heart. It is also known as the peripheral heart. Okay, and more deep to the soleus, laterally we consist of the tibialis posterior. Then more medially or in the middle we have the muscle, the flexor hallucis. Oh sorry, we have the muscle flexor hallucis longus. Flexor hallucis longus is more laterally and tibialis posterior is more medially. And then on the medialis side we have flexor digitorum longus. So to avoid the confusion, I have just mistaken a thing. So imagine this is the anterior aspect, posterior aspect, this is the medial aspect, and this is the lateral aspect of the left foot. So posteriorly we have first the two head of gastrocnemius. Okay, lateral head consists of a small muscle plantaris. This is a very schematic and a very basic diagram. Then we have the soleus, a whole bulky muscle, and then on the lateral aspect we have tibialis posterior. Then in the middle we have flexor hallucis longus, and on the medialis side we have flexor digitorum longus. So basically here somewhere the tibia will be, and here is the fibula. Okay, so I have mistaken a bit here, but the arrangement is like this. I will mark it: tibialis posterior, flexor hallucis longus, flexor digitorum longus, soleus, lateral head of gastrocnemius and medial head of gastrocnemius, and this is the plantaris. Okay, then the lateral compartment of leg consists of only two muscles, the peroneus longus and peroneus brevis. Mark my words, here is peroneus tertius and here is peroneus longus and peroneus brevis. So don't confuse between the three muscles. And in the foot we have small muscles, but they are not like, we do not have to learn them. So the foot is not very much important. The foot is important where the dorsal venous arch or the dorsalis pedis artery comes. Okay. Now starting with the fascia lata. So why we are describing this fascia lata? Because the attachments are important here. Why? Because the fascia lata extends from, let me write it here, it extends from inguinal ligament. Okay, inguinal ligament. And a small point to note, it extends from the inguinal ligament. Then it attaches to knee capsule joint anteriorly. Okay, these are the anterior relation. Okay, now the posterior relation, it extends from gluteus maximus muscle and it attaches on the foot, like on the back. Okay, means it continues downwards with the fascia of the posterior compartment of the leg. Okay, these are the posterior relation. This is for understanding. This is not a theory or something like that, but it is for understanding what is the fascia lata and where it is the attachment. Fascia lata is the modification of deep fascia. So in the anterior compartment of thigh, which we are going to study now, the fascia lata is present. So the relations or the superficial like the skin will be there, and then if we retract the skin, we will see the superficial fascia with some superficial nerves and all. Then behind the superficial fascia, if we retract the superficial fascia, we will see the deep fascia or the fascia lata, and then we will get access to the anterior compartment of thigh. So starting with the anterior compartment of thigh, what is important in the anterior compartment of thigh? In the anterior compartment of thigh, the important is the femoral triangle. So let me mark it a bit. The femoral triangle. So what is so much important about the femoral triangle? Let me discuss it. The femoral triangle, first we will describe the boundaries. Okay, as we described the boundaries of the cubital fossa and all earlier in the upper limb. So boundaries. Now it has a base, it has a apex, then it has a floor, and it has a roof. Okay, first I will write it and then I will draw it. The apex, the base consists of the inguinal ligament. Okay, the apex consists of the meeting point of medial border of sartorius and medial border of adductor longus. Then the floor from lateral to medial is iliacus, psoas major, pectineus, and then adductor longus. Okay, and the roof consists of, the roof is basically like the skin, as we discussed earlier, superficial fascia, then deep fascia, and then we get access to the femoral triangle. Now we will draw the femoral triangle. Okay, what we have told that the basis of inguinal ligament. So this is the ASIS, anterior superior iliac spine. Then let me draw the pubic tubercle somewhat like this. Just a second. So basically this will be the pubic tubercle. Then inguinal ligament extends from the anterior superior iliac spine to the pubic tubercle. Okay, basically like this. Now we have formed the base, so base is done. Then the apex. Now we have told meeting point of medial border of sartorius and medial border of adductor longus. So let me draw the sartorius. So how to draw the sartorius? Sartorius extend from the anterior superior iliac spine and go to the knee joint. Just a second. Okay, somewhat like this. So this talar muscle, it is also known as talar muscle. Okay, somewhat like this will be the sartorius, and the adductor longus, one attachment is like this and somewhat like this. So I will draw all in one diagram, or rather I will draw content separately. Okay, now this is the base. Okay, now the meeting point of medial border of sartorius and the medial border of adductor longus. So basically these are the boundaries. Okay, this is the femoral triangle. Now to draw the floor, how to draw the floor? So basically the floor consists of iliacus, psoas, pectineus laterally. Sorry, the iliacus and psoas laterally. So iliacus will be like this, so I will name it as I. The psoas will be somewhat like this, so I will name it as PS. Then just a second, this will be the iliacus, this will be the pectineus, this will be the psoas, this will be the pectineus, and this is the adductor longus, this is the sartorius. So I will just highlight the floor, how it is: iliacus, psoas, pectineus, adductor longus. So the floor is brown. Then the roof. The roof is already described: the skin, superficial fascia, the deep fascia, no need to describe. Okay, now we will draw the contents of the femoral triangle. Let me just just a second. So to draw the contents of the femoral triangle, what are the contents? The content is femoral sheath, then the femoral nerve, then the lateral cutaneous nerve of thigh. A bit part comes here somewhat. It is not considered, but in Gray's Anatomy, the lateral cutaneous nerve of thigh is mentioned. But no need to mention it because it is a little dicey condition. Okay, now what is the femoral sheath? We will describe the femoral sheath a bit later, but the contents of the femoral sheath and femoral triangle are common. So what is the content of the femoral triangle? The femoral triangle basically contains the femoral artery. So you should draw the femoral artery somewhat like this. Then the femoral vein. The femoral vein is more medially. Oh sorry, I forgot to give you the orientation. This is the medial, lateral, superior, inferior. Okay, and the femoral nerve is somewhat like this. It goes like this. And one more content which comes with the femoral artery, a femoral branch of genitofemoral nerve, and goes somewhat like this. Okay, also some lymph nodes. Not to forget the lymph nodes, they are very important. Somewhat like this, there will be lymph nodes. So this is the femoral artery, this is the femoral vein, this is the femoral branch of genitofemoral nerve. Okay, and this is the femoral nerve, and also these are some lymph nodes. Now one more term, femoral sheath. I mentioned it earlier. So the femoral sheath is basically a modification of the fascias which encloses the femoral nerve. Okay, then the femoral artery. Okay, femoral nerve, femoral artery are covered. Then the femoral branch of genitofemoral nerve, and also the lymph nodes. This is the part of femoral sheath. So they are the contents of the femoral triangle. So we can say that femoral sheath is the content of femoral triangle, and femoral nerve is also the content of femoral triangle. So these are the contents of the femoral triangle. Also the femoral triangle, in the femoral triangle, the femoral artery gives some branches. So we can write the branches like, just a second, I will write it here. Femoral artery. branches. So in femoral triangle we get 6 branches. Okay, the 6 branches, they are classified as superficial, deep. So as we know, first I will write the origin. So femoral artery is from continuation of, so what is the continuation of femoral artery? Yes, the femoral artery originates from the external iliac artery. So superficial and deep branches. So what are the superficial branches? See, they are very easy. I will write S for superficial. So first branch. So the first branch is superficial external pudendal artery. Second branch is superficial epigastric artery. Never confuse superficial epigastric artery and superior epigastric artery. Superior epigastric artery, there is a trick I will tell you. I remember it like this. The superior epigastric artery, the superior epigastric artery is more superior. Okay, so superior epigastric artery, it arises from the internal thoracic artery. You know, internal thoracic artery in the sixth intercostal space, it divides into superior epigastric artery and musculophrenic artery, and this superficial epigastric artery, it arises from the femoral artery. Okay, so superficial external pudendal artery, then superficial epigastric artery. Okay, and the third branch is the superficial circumflex artery. Okay, superficial circumflex artery. Now going to the deep branches. The most prominent branch, the deep branch, is profunda femoris artery. Okay, this is the most prominent branch, the profunda femoris artery, the main branch, which is the deep branch of femoral artery. The next branch is deep external pudendal artery, and the third branch is some muscular branches to the muscle. Okay, these are the muscular branches. Now this was all about femoral triangle. The contents, the first we described the boundaries, then we drew the diagram, then we told the contents. Let me just highlight the contents. These are the contents. Okay, and these are the boundaries, the sartorius, adductor longus, inguinal ligament. So these are the boundaries, these are the contents, then this is the floor. Okay, the femoral artery, we describe the femoral artery, its branches. Okay, now going to the femoral sheath. So what does the femoral sheath is about? So basically the femoral sheath, it is an extension of fascia. Of which fascia? We will discuss it now. Okay, I will give some headings. Femoral sheath. Okay, just a second. So basically this is a sheath which is made by two fascias. Okay, anteriorly one fascia and posteriorly one fascia. So we know a fascia which comes from the abdomen is the fascia transversalis, which is very important in that rectus sheath kind of thing and the layers of abdomen. Yes, so that fascia transversalis extends downwards anteriorly and forms the anterior wall of femoral sheath. So fascia transversalis is the anterior wall of femoral sheath, and posteriorly we see the fascia iliaca. So basically to give a rough idea, don't draw this, but to give a rough idea, this is the fascia transversalis, which extends, just a second, which extends from the abdomen to the leg, and here a kind of iliacus muscle is there, the floor of femoral triangle we described, and one fascia, the fascia iliaca comes from the iliac muscle, and basically, sorry, this is both the fascia joints, and they give rise to a sheath. So basically this is the basic idea of femoral sheath. So now the femoral sheath is a funnel shaped sheath. Funnel shaped sheath. Funnel shaped. Okay, this is the funnel shaped sheath. And to draw the femoral sheath, we will draw like this. Just a second. Since it is a funnel shaped, so first a sheath like structure, means an oval, then extend a bit downwards, extend this too, and since it is a funnel shaped sheath, it is like this. Okay, now there are compartments in this sheath. Okay, so to draw the compartments, this is the medial most compartment, this is the intermediate compartment, and this is the lateral compartment. Okay, now what does this medial most content this means, what is the structure in the medial most compartment? So some lymph nodes, okay, are present in the medial most compartment, and the name of this lymph nodes is lymph nodes of Cloquet. Okay, then as we saw in the femoral triangle, what was the intermediate structure between the lymph nodes and the artery? Yes, it was the femoral vein. So let me draw the femoral vein too. So this is the femoral vein, and the lateral most compartment consisted of femoral artery. Yes, you saw in that figure. Femoral artery, and along with the femoral artery, one nerve was present. Which was that nerve? Yes, femoral branch of genitofemoral nerve. Okay, so this was all about the femoral sheath. Now coming to the applied part, it is very important. Purple for applied. So applied, the first and the most important applied is the femoral hernia. So due to raised intra-abdominal pressure or some tedious or some very tedious work, the contents of the loops of the intestine can come in this space. Let me highlight those space. The lateral the medial compartment, since lymph nodes are present, so in this compartment the loops of the intestine, like it can entangle here in this space and produce a lump. Okay, a lump in the region of that area, the somewhat medially to the thigh. Okay, and on cuffing, the lump will be like it will irritate the space there, and pain will be caused on cuffing. So cuffing will cause pain. This is the most important part. Okay, so femoral hernia. So what does this femoral hernia? Femoral hernia, basically the intestinal loops get entangled and comes in the medial most septum of the femoral sheath. Okay, so basically femoral hernia, the one main feature we talked about, cuffing causes pain. Okay, also this area, let me separate it, yes, with red. So this area, the middlemost compartment, is the site of femoral hernia, and it is also known as, the medialmost compartment is also known as the femoral canal. Okay, cuffing causes pain. Also, herniation of intestinal loops into femoral canal. Okay, then one more important, it is common in female. Why in female it is more common? Because there are three reasons. Okay, the three reasons are: females have wider pelvis. Okay, size of blood vessels, means in this blood vessel, the femoral artery and femoral vein is small. Size of blood vessel is small. And also the third reason, the femoral canal is more wider in female. Okay, this was about the femoral hernia. So femoral hernia can be reversed, okay, through the course, like it can be pushed back into the abdominal cavity. It is reversible. Okay, but if strangulation occur, means intestinal loop winds around each other, then it is impossible to reverse, so, or difficult to reverse the hernia, so it is surgically repaired. Okay, one more applied, femoral artery catheterization. Okay, catheter is passed through femoral artery. Okay, and it can be used as a graft artery, or in like the angioplasty surgeries and all, it can be used as a graft artery. Okay, so catheter is pushed. One last applied, femoral artery pulsations. Okay, this was all about the anterior compartment of thigh, and also we described the femoral triangle, the femoral sheath. Also we took a short discussion on femoral artery, the branches of femoral artery, and the nerve supply of the anterior compartment was the femoral nerve. So now coming to the medial side of thigh. The medial side of thigh is pretty much not very much important, but it consists of the adductor muscles, so also known as adductor compartment. Adductor, ADD, sorry, it is adductor. So adductor compartment because of adductor muscles. Now, what are the adductor muscles? As we have described earlier, adductor longus, adductor brevis, adductor magnus. Okay, and what is the nerve supply? It is the, let me write it in yellow, obturator nerve. Okay, now one diagram is much more important in this diagram. In this medial compartment also gracilis is present, I forgot about that, and obturator externus, obturator internus, it also comes under the, basically pectineus and all. it comes a little in the adductor compartment, but it is a little deeper muscles. These are the muscle which can we see. Also pectineus. Okay, an obturator nerve supplies the muscles. Okay, these are the all the muscles. Okay, let me add, I forgot pectineus. Okay, now the medial side of thigh. How to draw the nerve supply? The nerve supply is pretty much important in drawing the medial compartment. So basically I will first draw the diagram. So basically you are viewing the foot, the left foot, from the sideways: anterior, posterior, superior, inferior. Okay, this is the anterior side, posterior side, superior side, inferior side, and we are viewing the lateral side of the left foot laterally. Okay, so now first I will draw the muscles. Okay, we have told pectineus. So pectineus is a bit here, in little bit in the gluteal region. Then we have spoken about the adductor longus, the floor of the femoral triangle. Then the adductor brevis. Adductor brevis is midway between the two, and adductor magnus is a huge muscle. It extends from till the back of the leg. Okay, gracilis is midway between the adductor longus and adductor magnus. And then we have the obturator externus. The obturator externus is not very much important, so we will not draw here. Okay, obturator externus is the deeper muscle and it comes in the gluteus region. Okay, so the obturator nerve comes from here, the anterior rami of L2, L3, L4, the ventral rami. Then it divides into two parts. Okay, it is the anterior division, this is the posterior. I will write in short: anterior division, posterior division. So the anterior division supplies the first time, this is the pectineus, adductor magnus, adductor brevis, adductor longus, and this was the gracilis. Okay, now the anterior compartment first gives branch to pectineus, then adductor longus, and the gracilis. Okay, and it also gives a branch to the knee joint and all. Okay, so it continues like this. The posterior compartment goes like this, goes to the adductor magnus, and then it continues downwards as genicular branch of posterior division. Okay, now you will wonder why haven't I given branch to adductor brevis. Okay, so adductor brevis is basically supplied by both the muscles, both the nerves, both the divisions. Okay, sometimes it is given by anterior division, sometimes it by posterior division, or sometimes it is given by both. So I have drawn it as a dotted line. So obturator nerve. So this was all about obturator nerve and the medial compartment of thigh. The testing of the adductor muscle is one of the applied. It is not a very important, but it is a bit okay-ish. It is important for practicals. Okay, one applied I will like to mention. Okay, one applied is referred pain. So I forgot to give two branches, one to the hip joint and one to the knee joint. Hip joint, knee joint. Because of the irritation of nerve, the obturator nerve at knee joint, pain is referred sometimes to hip joint due to common nerve supply. So this was all about the medial compartment.